is Donna Teal. I am the partner and CEO of Teal Insurance Agency. I've been serving Medicare beneficiaries for about 6 years now, and one of the things that we've learned as we serve Medicare beneficiaries is that in order to make a good decision about Medicare, you really have to understand the Medicare system and how it works, and many folks don't. So that's why we brought this presentation together, and I'm going to teach mostly out of these two books. These are the Medicare and You Handbook for the current year, and each Medicare beneficiary should receive this handbook every year from the government. If you don't, you can call your local Social Security office and find out where in your local community you can get one. This will have all of the changes and references to the program for this year. We're also going to be talking about Medicare, what they call Medigap policies, and so the government also has a publication each year that's called Choosing a Medigap Policy. And I just wanted you to know that that's where most of our information from today is going to come from. Now, there's also some other places that you can get information on Medicare and Medicare supplements. You can go to the website, www.cms.gov. You can also go to medicare.gov, and this is a website I use frequently in my business and my dealings with my clients because it's just a wealth of information. If you're not familiar with the computers or you're not comfortable doing it that way, you can also call 1-800-MEDICARE, and they do have a hearing impaired TTY number. You can call your state health insurance assistance program, and they can give you information on Medicare as well. Or you can call your local Social Security office or the 1-800 Social Security number. Okay. So, what is Medicare? That's the biggest question we have today. Well, Medicare is actually a health insurance program for people 65 or older, people under 65 with certain disabilities, or for people of any age who have end-stage renal disease. This is permanent kidney failure, usually requires kidney dialysis or a transplant. So let's talk about the different parts of Medicare, because we have to understand what the parts are and how they fit together before we can make good decisions about how we want to get our Medicare benefits. So first we have Medicare Part A. And Part A is premium free to any beneficiary or their spouse who has worked at least 40 quarters and paid Medicare taxes into the government. So really it's not free. You've actually paid your Medicare premiums by working and paying Medicare taxes. If you haven't worked a full 10 years and you still want to get into the Medicare system, you can pay a premium for Part A. The premiums will vary depending on the number of quarters you have worked, and to get more information about this, you would call your local Social Security office. Okay? Now, Original Medicare also has another part. It's Part B. And Part B, you do pay a premium for. Last year, or this year in 2012, the average Part B premium was $99.90. And for most people, that was taken directly out of their Social Security check. Now, there are higher Part B premiums for people in higher income brackets. And again, to get more information about what those premiums might be, you can refer to the Medicare and You Handbook or call Social Security office. Now, there's a couple of other parts of Medicare I want to talk about today so that you're aware of what they are. Part C is what we call Medicare Advantage plans. These are plans that are offered by private insurance companies, and we won't talk a whole lot about them today, but they are out there, and it is another option. And then we also have Medicare Part D. Part D is the prescription drug coverage. It is also only offered by private insurance companies, and it's the way that people get coverage for their prescription drugs under Medicare. So let's talk a little bit more about these parts so we can have a better understanding of what they cover and what they do.